Hello and welcome back to another episode of Medicine in Small Doses with Dr. Amobi. I'm your host, Uju, and today we are beginning a 4-part series in honour of Men's Health Month. Men's Health Month runs from the 1st through the 30th of November each year. And today's topic significantly affects a number of men, especially men within the Black community. Today we are talking about erectile dysfunction. In this first part, we are going to be talking about how men present in their consultations with their doctor. So Dr. Amobi will be going through that. And it's not to make light of the situation. It is to see if it resonates in any way with you or can offer help to someone you may know. Part 2 is from another perspective. We're going to be looking at it from the viewpoint of the partner, the wife, who has come to see the doctor on behalf of their partner or husband who may be experiencing erectile dysfunction, and really to find out what they can do to help or how they can encourage their partner to see the doctor themselves. Part 3, we're going to have the man that has come in, made that significant step to see the doctor about a very real issue and what they can expect from their GP appointment. And the last part, Dr. Amobi will be going through how you, the listener, can improve symptoms of erectile dysfunction so that you can enjoy a life of vigor and vitality, which is what we stand for here at the Lifestyle Wellness Clinic. So without further delay, let us get into it. Dr. Amobi, hi, and welcome to another episode.
Thank you. It's a pleasure being here. We're talking about something super important in men's health. You know, in my estimation, one of the most important things to talk about. So I'm happy for us to dialogue, and I hope listeners, you guys find this very useful. I know it's a very touchy subject, and we will try to be as sensitive as we can. But the overall aim here is to provide valuable information, because back in the days, we used to see men age 40s and 50s in their first presentation of erectile dysfunction. But these days, we are seeing men as young as 20 years old. So it's vital that we talk about erectile dysfunction in this instance, particularly in Men's Health Awareness Month.
Of course.
Yeah.
Seems like the situation is getting desperate. And as you've mentioned, or we said at the top of the episode, Black men are being affected by this on a large scale. So before we get into it then, Doctor, can you clarify what is erectile dysfunction?
So erectile dysfunction has 3 parameters. Number 1 is men's inability to get an erection. 2 is you need to have erection that you're able to maintain through intercourse. And 3 is you would have to achieve what your definition of satisfactory outcome is, right? So that's in a nutshell exactly what erectile dysfunction means.
Okay. And what would cause a man to fall into the category of erectile dysfunction?
So if you break it down into physical health, psychological health, and social health. So from a social health perspective, you're looking at things like the stigma attached to erectile dysfunction. Those are things that would make men, may affect the erection, ability to get an erection. Psychological health, stress. It's so difficult for you to see somebody who's stressed out or somebody who's depressed or get anxiety, and the first thing that comes out is an erection. It just doesn't work that way. When it comes to physical health, example of physical health is things like diabetes, high blood pressure, heart disease, stroke, prostate diseases, and things like that. And if you look at all these parameters, you would see that we as Black men rank number 1 within the social issues, because of course that goes without saying. Then you look at psychological issues. We are 4 times more likely to have mental health disease. We are 4 times more likely to have anxiety. Then when you come to physical health, we rank number 1 in prostate disease. We rank number 1 in blood pressure. We rank number 1 in diabetes. So all of those things have significant impact on black men, let's say. And one of the things you might notice is that most studies that looked at erectile dysfunction tend not to focus on black men a lot. And I think that's one of the reasons why we said, look, I know it's a very sensitive topic to talk about, but it's very important that we bring a shine to it. Yes.
Okay, great. So let's get into the 5 ways that men have presented in your clinic with this issue.
Right. So this is the interesting part. I think I'll prefix this by saying that we're biologically wired to fix things, right? Mm-hmm. So we are less likely in general to visit doctors. We tend to have this like fix it or forget it approach when it comes to our health. The only time a man goes to see a doctor is like when that problem becomes so significant that they can't manage it at all. So the number one reason, I think, I would rank number 1 is men who will come to clinic and say, my wife sent me.
I actually read something about that recently to say that in a heterosexual couple relationship, it's usually the women who are encouraging their men, going to the doctor, have you seen a doctor, and even booking their appointments. So actually, I'm not quite surprised that you said that.
Yeah, no, in my estimation, I think that without black women or without women in general, most men would be dead. Right? No, honestly. And this goes beyond erectile dysfunction. Almost every other man that comes in my clinic goes, my wife is worried about X, right? And then that's the reason. And for most of them, they would have showed up when he's become like very contentious at home, and then they decide to just rock up to the doctor, and they wouldn't be taking it as serious as their wives or their partners are. So
we're going to get into that more in the second part anyway. So sure. That's good. Okay. So let's continue.
So number 1 is my wife asked me to come.
Right.
Now, it's quite interesting because I always ask these men, like, if your wife is worried about the erection, why are you not worried?
Yeah.
Right? Mm-hmm. And then they will come up with like a lot of, I've been a bit stressed at work. And some of these things are legitimate reasons, etc. But the driving force, number 1, is the wife asked them to come to go and see the doctor.
Yeah.
So I would say number 2 is men are very funny. I would see men in clinical practice who will show up to talk about erectile dysfunction, but they start talking about something entirely different, right? So the sole purpose of seeing me today is to talk about ED, but they'll start with headache, or they will say something like, my eyes are twitching at night, or my feet are hurting. Is there any blood test that I can run to find out what may be causing this problem, right? So, and then you will say to them, okay, cool. They go, can I just get a general MOT then? I would say to them, what type of MOT do you want? So we can run like basic blood tests, or we can do something a bit more specific. Now, if you're a doctor worth your salt in clinical practice, whenever men coming a bit dodgy, something dodgy is going on, right? So you have to put your antenna up, and don't let them leave. Because if you're a doctor or a clinician or anybody listening to this, my style of doing it is usually, I'll say, look, we run routine blood tests, which check your blood count, etc. But there are some specific tests I always do on men, things like prostate, things like testosterone, things like your thyroid functions and things like that. The reason I do that is to see if I can find some of the conditions that men are less likely to present with, things like erectile dysfunction. I will guarantee you 99% of them, once you mention erectile dysfunction, their eyes would lit up like as if you just read their mind. They go, can I get one of those? You go, which one? They do, and they wouldn't even say the erectile dysfunction. They would say like the last one you mentioned.
Right.